seriously, you need to drop this weight. It's killing you. I cried. I cried all the way home. And I said, okay, I'll do it. I'm excited to go through this surgery because I believe on the other side, there's so many benefits to that several years ago, I would never have thought of it that way. It's been an incredible journey for a year. I've dropped 103 pounds, but more so than that, the health benefits, the returns of off the insulin pump. I didn't know that there was a way to live without being short-breathed, living on nitro. Not everyone is got that opportunity to reclaim health. I am very blessed that that has been the case. I didn't go into it with that. I was going into it to just keep status quo, to keep my life. But I think I'm going to have even a better quality life going forward. And that's the exciting part. Oh,
There you go.
that's better.
Alrighty.
Okay.
Right this way.
Okay. Yeah.
Hey, how are you, Dr.
How are
Brown?
you? Good to see you.
It's good to
So I
see
heard you
you.
just went under 200 now?
Yes.
Good for you.
I was telling, maybe it wasn't Nancy, last week I had, according to my records,
Uh-huh.
I was down 103
Good.
last week. The first measurements I took were 219 last year,
Okay.
2 days before surgery. And then I measured today in the bust, 9.5 inches down.
Mm-hmm.
In the waist, 12.5.
Sweet.
And in my thigh, 6.
Good.
Yeah.
Awesome.
So I'm excited.
So what's that do in clothes? Like how many clothing sizes did you drop?
I was wearing a 22, 24 woman size pant. These are 14 and they're big.
Good.
And I went from a 26, 28 top to, depends on the top and how it's made, extra large to a large.
Good. Good. That's great.
Did you have any idea when we started this that I could be doing this good? Oh, well, you probably did.
Oh yeah.
I didn't.
Yeah.
It's just, I looked back at the episodes because it came up on my Facebook feed
Uh-huh.
the other day. And I thought, what was I thinking? No. But I can see where I hit the 3-month mark and had really lost the hair, at 3 months.
Yeah.
And it's come back in,
Yeah.
and and I thought, well, I was looking pretty good then. Thank goodness I
Not like
thought
now.
that because I
Yeah.
kept going.
Yeah. Not like now. You look great.
Yeah, thank you. I feel good.
Yeah.
There's just so many
That's
win-win-wins on
That's
it.
why you
that-
did it.
Yeah,
Yeah.
exactly. I thought, crazy to me, I thought it was just to drop some weight.
No. It's.
But
it's
you know
all-
what? I cannot stress that enough to people that it is a redo, and that is just, it's unreal.
Well, she's such an amazing patient. She's so compliant and, like I say, she's very enthusiastic, a model patient. She knows how important the exercise is for her blood pressure and for her heart.
Every time I saw Pam for a post-operative appointment, there was just a new person, a new outlook on life, new goals, new directions that she wanted to take with her life, and just a huge change. It's been immeasurable for Pam. Lots of stuff had changed. One thing that comes to mind is she was really excited about trying on some clothes for somebody she used to work with. She's also talked about going horseback riding. She talked about just hugging her husband, which is something, that was difficult at the time before.
Probably a month ago or so, I said, I just realized I can really hug you. Put my arms all the way around him, and he can put his arms all around me. Before my gut got in the way. I could only hug him so much. And it sounds crazy, but it's those little bitty things you're thankful for.
With surgery, there's a lot of aspects to it. The typical encounter with a surgeon is you see someone for a surgical disease, you operate, you maybe see him for a couple of post-operative appointments, and then you really don't know what else happens in their life. With bariatric surgery, it offers kind of a unique perspective for surgeons where we do follow patients long term and kind of see how it impacts and changes the patient's lives. It's kind of the beauty of what you see in primary care medicine, along with what we love to do, which of course is surgery.
I felt like I had no more control when the heart issues started and the diabetes and for the first time in a long time, I feel like I am in control of me, not just my emotions, my health. I'm thankful for them. They see the bigger picture, that what help people need, you know. I'm sorry, because I may not be here still today if, you know, I just don't know with where my heart was going. And the doctors have done all that they can do. It was my job now to regroup it. I worked for a designer years ago. His name is Manuel. But the thing that broke my heart is when I worked for him, I could never try on any of the coats in the stores that he does. So that's my goal, is to go back down to his store. He still has his store in Nashville, and try on any coat I want. When I walked in and said, "Hi, Manuel," he stopped and he looked at me. Now, he had seen me at my very worst just the year before. And he said, "Look at you," you know. That meant a lot coming from Manuel. Oh, yes. Oh, Manuel. Oh, look. Oh, yeah. Now we're talking.
That's pretty close.
Oh, it is nice. I love this one though, this brown. I was able to wear Little Richard's coat. It's a purple with a lot of rhinestones, and it hung clear down to here on my, and I said, "Well, Manuel, I thought he was a smaller guy." And he said, "That's just his name." At least I can say I'm one.
Look at you.
And always know, even though I don't talk to you a lot, you're always in my heart. You're
Thank
very
you.
special. You know you're very, very special.
Thank you. All right.
I haven't ridden a horse since I was a young girl. My grandfather had horses when I was very, very small. My dad and he rode horses. I kind of had put it out of my mind, because I was too big. So that kind of became a goal to achieve.
Yep. Very good.
There we go. Well, Dr. Brown and his staff at his office, his nurse, he's such an awesome doctor. Awesome. And Wesley Woodlawn and their staff, you know, the bariatric center, and even the staff when I was in the hospital have been just awesome. Wesley Woodlawn is the place I like to go.
Initially, when we see patients in the office, we set a goal, and the goal is based on their ideal body weight versus what they weigh at the time. And then we calculate a certain percentage. Usually we say somewhere in the realm of 70 to 80% of their excess body weight following a gastric bypass surgery like Pam had. Pam's done wonderful. She's past the century mark, which is kind of a huge goal for most patients, and she continues to lose, but right now she's at a very healthy weight. She's very happy where she is.